Once I consulted with a patient in Australia, almost like 5 years ago. He had had a previous hair transplant done elsewhere and was not happy at all. And he said something that has stuck with me ever since. And he said that a hairline should be so constructed, so designed by the hair transplant surgeon, that a patient after a hair transplant should grow into his hairline rather than grow out of it. There is so much wisdom in these two lines. It shows how hairlines are so important in the final result we seek after a hair transplant, and how a poorly designed hairline, even if the person has achieved a head full of hair, will leave a permanent stigma for a long time to come. Hairlines are very important. By aesthetically framing your face, they are a window to a youthful look. No part of the hairy scalp is so intimately linked to your body image and your psyche like a hairline is. A hairline is the first indicator of thinning, and it's also an indicator of a properly done hair transplant. Like in this case we are going to discuss now, and subsequent to this we will also discuss various hairstyles that can be used to hide a thinning look, various types of hairlines that occur in men, and other things as well regarding a hairline. So stay on. This young man who came to us for restoration of his hairline through surgical hair restoration, an FUE procedure was done using around 1900 scalp grafts. The post-operative phase for 6 months was uneventful, and he was constantly under the umbrella of 1 milligram finasteride taken daily for 6 months. After which he came to us for a review. The patient is a happy man today. The hairline looks so natural and complements his face. It may be low set, but it does not look to be unnatural. If you want to see more cases of hairline design at Darling Buds Clinic, there is a link below and you can go through the videos that I have provided there. So let us talk about a hairline. What is the definition of a hairline? So to put it simply, it is a fringe of hair, the leading edge of the hair above the forehead, and constitutes a part of the frontal mop of hair. It is a transition from the forehead to the hairy part of the scalp. Hairline is a part of your personality. Every hairline is unique and distinct. Just like thumbprints, no two hairlines are the same. A hairline is determined by our genetics, by our hormonal milieu. It is determined by the shape of the skull. It is also determined by various environmental factors like stress. And as previously discussed, age is also a determinant of the type of hairline. We all know that a hairline is not constant. A hairline continues to change, continues to evolve with age. Just like the shifting sands of a shoreline, the hairline is dynamic. As we grow in age, the hairline will set back. At least in most people it sets back. In some people, the hairline continues to be low set. In these patients, they continue to have a head full of hair throughout their life. But when a hairline recedes substantially, it is a harbinger of things to come. It means that baldness or androgenetic alopecia is knocking at the door. So what are the common types of hairlines? A hairline can be low placed. It could be a middle hairline. It could be a high hairline. A hairline could have a widow's peak and get accentuated in the center of the forehead. A hairline could be gently receding or M-shaped. A hairline could have a bell shape. It could be a simple straight hairline. A hairline could be uneven. A hairline could be a hairline of traction alopecia. And lastly, it could be a cowlick hairline or a hairline which has swirls or whorls like we see in the crown. So these are the types of hairlines, and we are going to discuss them one by one. A hairline is low set if it is 3 finger breadths above the glabella point, or what we call as the brow. This sort of hairline is commonly seen in adolescence and in early adulthood. It is so ironical that when testosterone surge happens in adolescence, around 16 to 18 years, though there are other parts of the body like the face, the chest, the trunk, the pubis where hair forms, and also in the armpits, the hairline begins to recede. So in most cases, recession of hairline along the temples is considered as a form of secondary sexual characteristic. The leading edge, the leading rows of hair along the hairline, along the adolescent hairline, start to efface themselves, and the hairline slowly shrinks, especially on the temple points, and it forms an M shape. However, a low hairline can persist for longer time. There are people who have a low hairline even in late adulthood. These are the people who have been blessed with a head full of hair, and their hairline continues to youthfully frame their face all their lives. Well, but they are a rarity. Then we go on to the middle hairline, which is the commonest hairline we see usually. It is 4 finger breadths above your brow. That is considered a normal hairline which most people have, and which is considered an ideal place or ideal location for a hairline after hair transplant. A high hairline is one which is 5 finger breadths above the glabella point or the brow. This makes the forehead look very wide in both the horizontal and vertical dimensions. And these are the patients who seek a hair transplant very often. The convex part of the forehead becomes more noticeable and more shiny when flash falls while taking a picture. The double reflex makes the forehead look even bigger in pictures. The bossing of the forehead is more prominent in profile. And then we go on to the widow's peak. When we talk of the widow's peak, 2 personalities come to my mind. One is Dracula and the other one is the Joker. The most prominent widow's peak can give a sinister look to the right personality type. In others like Nick Jonas, Keanu Reeves, Leonardo DiCaprio, and even Marilyn Monroe, it looks very appealing. Well, it's all got to do with the structure of the skull bones underneath, whether the hairline will look sinister or it will look pleasing. Also, your personality type will determine how your widow's peak is appreciated or interpreted by the people you meet. So widow's peaks can also look very attractive. Many people show off their widow's peak by brushing their hair backwards or tying the hair in a ponytail to make it look more prominent. Many alpha males are known to have widow's peaks. So there are so many myths and impressions that surround widow's peaks today. In 18th century England, ladies whose husbands had died would wear a triangular hat with the point falling along the center of the forehead. The dark myth that a widow's peak heralds an early widowhood is misplaced. And then we come to the receding hairline or the M-shaped hairline. Even in those who do not have the baldness gene, even in those who are not likely to have androgenetic alopecia in the future, even in these patients, the hairline is often programmed to recede. The front few rows of hair get effaced with time and an M shape develops. This is very normal in patients without baldness. The first sign is receding of temples, and then the whole hairline and temple points follow suit. And then we come to the bell-shaped hairline most frequently seen in African Americans. It is a smooth hairline. It is perfectly symmetrical. There are no irregularities whatsoever. It's like a straight line, and it very pleasingly frames the face in certain skull types. And then the straight hairline, which is a smooth hairline, it frames the face very appropriately and youthfully, and it permits almost any hairstyle. And then coming to the uneven hairline, where there are gross irregularities, the left side will not match the right side of the hairline. Both are not mirror images of one another, or even remotely so. This is very commonly seen and it looks pretty natural. However, these patients often do not appreciate a hairline which is not symmetrical, and they will ask for a hair transplant. And now the hairline which is called a cowlick hairline, a hairline which has swirls or whorls which are more commonly found in the crown area, but they occur in the hairline in rare patients. 2% of the population has swirls along the hairline. They make the hairline look rather messy. A lot of hairstyles cannot be sported by people who have cowlick hairlines. And many times the cowlick hairlines have double whorls or double swirls, and it makes matters even worse. The greatest difficulty in planning a hairline in patients who have swirls or whorls along the hairline, the leading edge of the hairline, is while making the slits at an appropriate angle. It is a daunting task making slits in a patient who has swirls along the hairline. And lastly, we come to traction hairlines. Most common in our part of the world is patients suffering from sick traction alopecia. There is a straight line, a straight transition point, a sudden transition point from the forehead to the native hairline. And this is an abrupt transition. A sick pattern traction alopecia can be detected from a distance. It affects the hairline in various severities. It affects very commonly the temple points. These hairlines are associated with scar tissue and therefore present a challenge to the hair transplant surgeon. In the end, there are patients who have thinning along the hairline, but they are not ready yet for a hair transplant. It could be because their age is less, they could be 19 to 22 years old, or they simply do not want to go for a hair transplant. In these, there are 4 hairstyles which need to be noted if you have a thinning hairline and you do not want a hair transplant just yet. Number 1 is a buzz cut. A buzz cut, which is a 4 to 5 days growth of the hair stubble after a clean shave has been done. In patients who are thinning and have long hair, if they have a buzz cut, they look much younger than they otherwise would have looked. And then we come to the crew cut, which is a common military cut in which the backs and sides are trimmed short, but the mop of hair on top of the head stays, and there is a contrast between the shaved sides in the back and the mop of head hair. This makes the thinning much less noticeable than it otherwise would have if the sides were not shaved, and then the contrast would be reversed because a person will have much more density on the sides and the back than a person with a thinning hair would have. This is just an illusion that is sought to be created. A crew cut will lessen the impact of thinning to even an observant eye. And then we have a textured crop. A textured crop gives a little unruly look, and it covers the areas which are thinning, the temples, the hairline, and it gives a head full of hair look. And lastly, as we all know, a clean head shave. A clean head shave, especially in patients who have a round head, looks very appealing and gives a youthful look. So this is about hairlines today, and if you have any question regarding the case that I presented, regarding hairline design, or anything related to hairlines, I'm waiting for your comments. Do drop a comment in the box below and I'll be too happy to reply back. If you want to see other hairline results at Darling Buds Clinic, there is a link in the description box below. But still, if you have any questions, if you want any particular information, I'll be too happy to answer. Thank you for watching and God bless you.